live. Hello, my name is Stefan Hartman, physician assistant, exercise science specialist, and owner at ironmedicinepa.com. I have my third part in my series on controlling glycemic variability in diabetics. This is part 3 of 3. We're going to be going over nutrition for the most part. Very hard to talk about glycemic variability without talking about exercise. So there's going to be a little bit of that thrown in there too. And also a pretty important thing about non-alcoholic fatty liver disease and how to reverse that. So there's a lot in the scientific community about calorie restriction and how that's the only way scientifically to induce weight loss, especially in those with metabolic syndrome. We're going to look at some studies here showing how this is not necessarily true and how nutrition quality actually plays a huge and significant role in the metabolic syndrome patient. And if we are isolated in our thinking and just focusing on calories, how we really miss a big picture for many patients. But they're both important, calorie restriction and also nutritional quality. We're going to be focusing mostly on interventional studies. Epidemiologic studies are, oftentimes very flawed, opinion-based, and biased. And they use recall. So they call patients on the phone and they have them remember what they ate the previous day. So we're focusing really on interventional studies where they put people on a diet regimen and they watch them and they give them the food. These are the best studies that we can actually see changes in patients relatively quickly. We have to also mention that the American College of Cardiology recently has a huge paradigm shift on LDL and saturated fats, indicating that perhaps saturated fats are not the cause of heart disease and death, and that LDL is by itself not so important in focusing on because it really doesn't indicate cardiovascular risk mortality. But that's a whole nother lecture in and of itself. So let's look at some good studies here. Effects of a low carbohydrate versus low-fat diets on weight loss and cardiovascular risk factors, a meta-analysis of randomized controlled trials. So they found here that low-carbohydrate, non-energy restricted diets appear to be at least as effective as low-fat, energy-restricted diets in inducing weight loss for up to 1 year. And this is kind of astounding, really, because this is mainstream knowledge. Unfortunately, a lot of these studies don't use continuous glucose monitors, so not so important for diabetics, these studies. Many studies mention the Mediterranean diet, and I feel like there's a lot of flaws and misunderstanding of what is a Mediterranean diet and why is it effective. I actually lived in Italy for 4 years, and I know what a Mediterranean diet is because I experienced it, but I don't think it's so much the diet itself, but the culture that may prove that is giving some sort of benefits to Italians. So in my experience, many Italians would do intermittent fasting, not by purpose, but just by their culture. They wouldn't eat breakfast, really. They would have, an espresso, and many would have a cigarette or an espresso or 10. Not necessarily healthy, but they fasted a long time, and they would eat very small meals until maybe the evening time when they would have a big dinner with family members. They'd go out and they'd eat and drink till midnight sometimes. So no one's really discussed this about Mediterranean diets, but if you really live with Italians and see how they eat, this is actually kind of standard, and anyone who's lived in Italy anytime will know that I'm speaking the truth. So I'm not so sure about Mediterranean diets because no one really understands what those are. So let's talk about calorie restriction and matched weight loss from exercise, independent and additive effects on glucoregulation and the incretin system in overweight women and men. It's a very cool study. They had sedentary overweight men and women, and they were randomized to undergo 6 to 8% weight loss using calorie restriction, exercise-induced weight loss, or calorie restriction plus exercise-induced weight loss. And they found that both calorie restriction and exercise have additive benefits on glucoregulation, which we can pretty much assume to be true. Let's look at this one. Diet and exercise interventions reduce intrahepatic fat content and improve insulin sensitivity in obese older adults. And we can see how fatty liver disease is, in my opinion, part of the metabolic syndrome. So metabolic syndrome being hypertension, high cholesterol, obesity, and diabetes. And I would add on a non-alcoholic fatty liver disease, so fat on the liver. So let's see, what do they do here? So let's see. Diet with or without exercise results in significant decreases in intrahepatic fat content, accompanied by considerable improvements in insulin sensitivity in obese older adults. Very cool. A limitation of the study being that nutritional content was not considered. So that's one limitation of this study. Let's see, let's go down to the conclusions here. The results of our study showed that exercise training did not have an additive effect on diet-induced weight loss in reducing intrahepatic fat. The diet plus exercise group had a greater reduction in systolic and diastolic blood pressure than the diet alone group, suggesting that combining a diet and exercise have additive effects in improving blood pressure. So in summary, it appears that calorie restriction provides an important method in fighting fatty liver disease and improving insulin sensitivity. And I've seen this quite often in the literature, is that perhaps calorie restriction is probably the single most important thing, specifically for treating fatty liver disease. Maybe not other things, but fatty liver disease, calorie restriction is probably the most important thing. So let's look at this. And the effect of a short-term low-carbohydrate, high-fat diet with or without post-meal walks on glycemic control and inflammation in type 2 diabetes, a randomized trial. So they put patients on either a low-fat, low glycemic index diet, a low-carb diet, or a low-carb diet with 15-minute post-meal walks. The study showed that while low-carb and low-carb plus exercise led to superior improvements in glucose control and fasting proinsulin levels as compared to the low glycemic diet, all three diets appeared to lower cellular markers of inflammation over the short term. It was a small study, albeit, but I would take away a very simple message from this one, is that adding on a simple walk after your meal is helpful, no matter what the meal is. So what not to do? This is a really cool study that we're going to get into here. The effect of low glycemic index or high cereal fiber diet on type 2 diabetes. So what they did here, we're going to get to a graph in a moment, is what Jenkins did is he randomized 210 diabetes patients to 6 months of either a low glycemic index diet or a high cereal fiber diet. And we talk about these. And what are these diets? They're the best of breakfast cereals, grains, and pastas. It doesn't sound like something a diabetic would want to eat. And what other researchers did is that they looked at Jenkins' study and they compared it to other studies that looked at carbohydrate restriction. So very cool. This table here shows us decreases in the studies. So we can see the Jenkins cereal diet here and the Jenkins low glycemic index diet. The cereal diet showed the least benefit in reducing weight, the least benefit in reducing A1C and glucose. The Jenkins low glycemic index diet did a little bit better in blue. Here we can see the blue table, so you're going to actually improve HDLs a little bit and even decrease triglycerides. But when we get to the Westman low glycemic diet and the Westman low carbohydrate diet, we see the best results. We can see the pink bar here dropping in weight, dropping in A1C, dropping in glucose. The most significant one, and counterintuitively, would be the drop in triglycerides. Now, why would a low carbohydrate diet, so typically you're eating more fats, you're eating more meats with this, why would this lower your triglycerides? Now, traditionally we've been told that you have to eat less fat to drop your fat. And this study proves the complete opposite. And triglycerides being one of the more pathological markers for heart disease. So why is it that a higher fat or a low carbohydrate diet is dropping your risk for heart disease more so than the low glycemic index diet or the grain and cereal diet? This is a wonderful study. And unfortunately, the American Diabetes Association has not really adopted low carbohydrate diet as first line treatment for diabetes, which kind of blows my mind. But at least they've eliminated their suggestion that carbs should consist of 40 to 50% of the diet, which was their opinion up until 2010. So let's look at another one, a Mediterranean diet. So this one is a ketogenic Mediterranean diet with phytoextracts. Now they added this because patients who go on a strict ketogenic diet will sometimes get a keto flu. They don't feel so good. But when you add these phytoextracts like they did in this study, you kind of avoid the keto flu symptoms entirely. So this is kind of funny, is that they looked at Italian council employees, and they were kind of sedentary, kind of overweight, kind of chubby. Italians eating an Italian diet, right? Mediterranean diet. And they were eating a lot of carbohydrates, as I know Italians do. And they changed them to a low carbohydrate, high protein diet. And after 6 weeks, they showed a statistically significant decrease in BMI. Unfortunately, they didn't look at visceral fat. I was like, I should have looked at visceral fat in this study. It would have been so much cooler, because BMI doesn't drop that much. But visceral fat, as I've alluded to in other discussions, drops a lot quicker. They didn't actually notice any increase or changes in their BUN, ALT, AST, which is good, or their creatinine. Creatinine is a marker of kidney function, and BUN is another marker of high protein. So this is really cool, because a lot of people will be worried, oh, high protein diets, that's bad for your kidneys. Many studies show this is absolutely false and bogus, unless you have renal disease already. But yeah, these patients actually did very well on this low carbohydrate ketogenic type diet, and they lost 5% of their body fat. So really cool stuff for these city council employees. And the best thing about it is that their calories in the diet were unlimited, so you can lose 5% of your body weight following an unlimited calorie diet if you just avoid the carbohydrates. Quite enough counterintuitive, and doesn't follow with the calorie in, calorie out consensus. Doesn't low carbohydrate, high fat diet increase mortality? So there's literature reviews such as by Kim et al. In 2020 suggesting that LCHF diets increase mortality. This doesn't take into consideration the quality of the diet, and undecided sources in that lengthy article consider this critical factor. If we look at meat carcass profiles from grass-fed, free-range, grass-finished beef, it has a better inflammatory profile than feedlot corn-fed beef. We can look at a couple studies here showing that, but this is kind of well known as well. And again, these are epidemiological studies, so every time you look at an epidemiological study, you have to think, well, how do they know that these patients were following this diet and that's what's caused their disease? Were they smoking? Were they eating high fructose corn syrup? Were they drinking alcohol? Were they, eating seed oils in their burger buns with the meats? Like, there's all these variables. And when you hear about these, it increases mortality, you really have to think about that. All these little things before you make such great statements. So conclusions, epidemiological studies are limited by their nature. To know if a diet is controlling your glycemic variability, an interventional evidence-based approach with the aid of a continuous glucose monitor and your local expert physician assistant to monitor glycemic variability is best. And 2, calorie in and calorie out is often touted as the only tool for weight loss. However, interventional studies show that this is not necessarily true, nor the only way. Nutritional content is perhaps the more important factor, especially for diabetics and metabolic syndromes. And adding exercise to a calorie in, calorie out program does provide best results. Evidence shows that low carbohydrate, non-energy restricted diets appear to be at least as effective as low fat, energy restricted diets in inducing weight loss for up to 1 year. And many studies are continuing to show this. It is counterintuitive to think that you can lose weight on an unlimited calorie diet just by eliminating carbohydrates, but again and again, we're seeing studies that show this. And low carbohydrate, high fat, and higher protein diets appear safe and effective for controlling metabolic syndrome and losing weight, despite the American Diabetic Association's lack of motivation in recommending it. The quality of low carbohydrate, high fat diets is often overlooked in pretty much any epidemiological study, and many actually control randomized studies, is that they don't actually look at the quality of the meat profiles, the eggs that people are eating. Despite this, many of the studies show positive results for low carbohydrate, high fat diets. That's all I have for everyone today. Again, you can click on the link, read this PowerPoint for yourself, and go to any of the source materials. I hope you enjoyed this lecture. I'll see you in the next one. Bye.